Okay, you can show the model question and answer, not printed, handwritten obviously. And please, while you are writing that, please try to count how much time you are consuming. Okay, it is usually what we follow regarding our UG days or in PG even, that for each number it should carry around 1.5 minutes. Okay, so if it is a 10 marks question, it should take 15 minutes to write with diagram. If you want to change the color of your pen for highlight or highlighters, for all of that. Okay, and for 15 marks, that is the long question, it should be 25 minutes, because this is a 100 number question and you should have time to fill up the MCQs. Last time it was very much all collection, but try to do it on your own. Okay, otherwise what I saw in your copies, that a good student also answered some silly questions, wrong, silly answer, silly option that he or she chose for the MCQ. Obviously, that is, if he can write or that much good answer in the theoretical part, it should be good. He should have at least scored 8 to 9. In my expectation, it should be 10 for the MCQ. And also, one who got very much low score got 10 in MCQ. MCQs are supposed to be the very much detailed and gist of the topic. He or she answered for only 7 or 8 marks, or suppose 10 to 15 marks, but number got plus 10. That is not possible. যারা ফাঁকি দিচ্ছ, ফাঁকে নিজেরাই পড়বে। Okay, so in previous class we have discussed what is mental health, what do we mean about mental health, and what are the warning signs of poor mental health, and a brief overview on the National Mental Health Program launched in sir কত সালে? NMHP launched in which year? 1982. Correct. And we saw in last class that it has some limitations due to its structure. How we structured the program, it has some major limitations. That is when we decided that mental health should be incorporated at the district level. Central level will be there, but from district level, we have to incorporate it. The upper part is only for feedback purpose. They might create the policies and this and that, but how to incorporate, it should be decided by every district. Why is that? Because India is a land of diversity, so every district has their own problems and they have to fight on their own. If we take a simple example of our West Bengal, is the root of the mental problems same for North Bengal and South Bengal, or even for just two neighboring districts in your Bardhaman and Birbhum? Is the root is in the same? Think about the people living in there. Probably not. Okay. And also to get into the very much societal things, because mental health is still a stigmatizing issue. It should be monitored very closely. That is why district level health program, it should be monitored. Okay. not even in the state level. State will get only their own reports. That is why we promote or we started District Mental Health Program, that is DMHP. And when we think about that, that was on 12th 5-year plan. Okay. It actually has several improvement suggestions. First was manpower development scheme. Do you know how much time you give in your internship for psychiatry posting? 2 weeks. I think now it is 1 week or 2 weeks still. 2 weeks, still 2 weeks. Is that enough to get the appropriate, or at least is it enough to get the appropriate exposure on mental health issues? No, obviously not. Because if you go by the psychiatry textbooks, it is this much large. Own Harrison on its own, okay? Too much case history, too much drug and everything else. And every year some drug got banned and some new drug came into the market. That is why to train the people, we need to have some extra training camps. What we call this capacity building efforts. That the MOs or the workers, ground level workers such as ASA workers, they are able to recognize the diseases which lies in the normal or common people. That is why in manpower development scheme, what they first suggest that there should be a center for excellence where advanced research on the disease prevalence, disease definition, not prevalence, disease definition and the treatment can be done. Can you name any one institution? I named one in last class. NMHP. Another? What it's called? CIP Nachi. What it's called? CIP, Central Institute for Psychiatry. And what was the scheme B? Strengthening the postgraduate departments in mental health specialties. Previously, not many people took psychiatry. Okay. What is the reason? Because first there will be no absolute cure. So, যদি তোমার সাকসেস রেট যদি কম থাকে তাহলে তোমার কাছে কি আসবে বেশি পেশেন্ট? আসবে না। উল্টে there was a obviously there was a issue of violence, whatever. So we what the scheme be? PG departments in your college. Where is the psychiatry department, sir? OPD for OPD. Where is the IPD? Huh? Psychiatry IPD নেই. Okay. আমিও জানি না, আমি যেন জিজ্ঞেস করছি। What was the second suggestion? Upgrading central mental health institutes. Third, for support for central and state health authorities, and obviously form a central mental health team for national mental health program. Training and research activities, obviously, which is done by the PG departments or the central institutes. Form better IC documents. ঠিক আছে, কিছু আইসি ডকুমেন্টসে তুমি যদি if we put a diseased person picture in the IC material, will it aware the people? No. This is not like cigarette packets where a cancer picture has been pasted and obviously it does not change anything. But what we have to understand the people that a seemingly normal person can be affected from or already suffering from a mental disease. That is why we have to create better IC materials and obviously monitoring and evaluation of what are the information that already has been gathering. So we are coming to the now DMHP, that is District Mental Health Program. First, when it is started, that is during 12th 5-year plan, that was in 1996. Then it expanded, first it was started in 27. Actually in 1996 it launched in 4 districts. Then, actually this is wrong. Then it expanded to 27th, and now 767 districts across the country have been approved under this program. What was the milestone in 2011? That NMHS reviews the DMHP program in 23 districts of southern state, and what the model now we are follow or you are reading in your part textbook, they suggested those steps. Okay, any program is always an ongoing process. Every year it gets reviewed and reports actually come. Okay, if you are eager, or if you are eager to know, or if you are interested, you can go by the program sites that was either in Ministry of Health and Family Welfare, or they have their own portal. Okay, such as TB has their own portal, that is Niksai. It also right now has an Android app, Niksai Setu. But DMHP, if you go by Ministry of Health and Family Welfare or RMNCH even site, you can get to their separate portal. There is no direct access. So what were the objectives of District Mental Health Program? First, to provide sustainable basic mental health service in the community. Then early detection and treatment. For that, actually there was training materials that has been developed to recognize 9 identifiable and treatable mental health disorders. Okay, psychosis, neurosis, even manic disorder, sometimes mood disorder, addiction problems, those are listed in there. Then what was the another reason? To take the pressure off mental hospital. If we treat them at our in-house facility, we only have to refer the severe cases to the mental hospital. Obviously then their pressure will be also less. Fourth objective was to reduce stigma and to rehabilitate patients. After treating, the person should not be branded as mentally retarded. So he or she cannot be placed in a work. It was the previous views. But now, do we say mentally retarded person? Physically handicapped, now we call as Divyang. What is the term for mentally retarded? Those persons, those who are suffering from some mental disease, we do not term them now as mentally retarded. We call them person with disabilities, mental disabilities. Okay. What are the components? That means coming to the, if we have to incorporate some strategy, we have to do some specific section, such as here, to those who are responsible for provide sustainable basic mental health services, those who should not be in the work of to reduce stigma, that is the work of someone else. That is why there would be some institution which we term as components. What are the components? First, for first 2 objectives, there was service provision. What were the service components? In one component was service provision, and under that there are some other components also. Should we give them another only service? No, there should be follow-up, counseling, everything. Whatever the patient needs, not every mentally health, those who are affected from mentally health person need drug medication. Sometimes counseling is enough. Okay. Again, capacity building component. Those who are in charge of manpower training and development of prevention, early identification and management of mental disorder. And obviously the third component, those who are responsible for generation of IC activities. Under that you can write strategy. Usually DMHP strategies are not asked, but you have to know the objectives and the service components that will be asked, okay, in your exam. What was the service provided by DMHP? First, obviously the clinical services, including the outreach services. There will be some camps, these are and that. Also training all the ground level workers. Who are the ground level workers? ASA and Anganwadi workers. Just think about it. If I think all of have you seen the Tare Zameen Par? If the teachers in his previous school were able to detect dyslexia, does that child have to suffer that much? No. So the ground level worker include not only ASA and Anganwadi workers, the school teachers also. Then coming to training of all medical officers, those who are working in PHC or above, they has to be trained regarding identification of mental health problems and possible treatment. Fourth is obviously IC activities. A component of the DMHP will oversee the IC activities. Then coming to the targeted interventions are being focused on life skills education and counseling in school or college counseling services. There school counselor, তোমরা হয়তো অনেকেই যারা পড়েছো ইয়েতে সেখানে স্কুল কাউন্সিলর ছিল তো, কেরিয়ার কাউন্সিলর। আমার মতো যারা জেলা স্কুলে পড়েছে সেখানে কাউন্সিলিং হতো না, তো এখন তো অনেক রকম স্কুল ইয়ে হয় যারা অন্য কিছু ফলো করে। স্কুল কাউন্সিলর, those who counsel on your all your problems, even career counseling happen na some private schools, huh? বাইজুস আর আকাশ ওরা কেরিয়ার কাউন্সিলিং করতো। কেরিয়ার কাউন্সিলিং করলে তো ওদের যদি কেউ ছেড়ে দেয় তাহলে তো বিপদ হয়ে যাবে। আলটিমেটলি দে আর অল বিহাইন্ড ওয়ান থিং, দ্যাট ইজ মানি। হোয়াট এভার, এটা বাদ দিতে হবে আবার। হ্যাঁ, then obviously workplace stress management and suicide prevention services. Usually DMHP hospitals also run telehealth service on suicide prevention and workplace stress management. That means in your work level, if you are getting scolded by your boss or anyone else senior in the position, it creates stress. Not only that, if you are working 10 to 6 every day, 10 to 6 from Monday to Saturday, and your work needs too much decisive actions, then obviously stress will be built, and we have to address that. Work level stress got recognized, actually get global recognition in 2016 when a study published that 1 out of 5 working adults are suffering from depression. When we searched for the root for depression in working adults, first came the unemployment issue. We cannot do anything about that. Unemployment people को employment होना चाहिए, वो कैसे होगा पता नहीं. Then what was the next second most reason? That was those who are employed, they came to the second. What is the reason? Work level stress. Okay, so that is why we actually the ministry actually created some guidelines for implementation activities where mental health training was for medical officer, paramedical staff, even for police officer, prison staff and teachers, and faith healers are also involved. Okay, faith healer actually we do not see in our West Bengal that much, but in rest of the country we see many babas, right na? They also came under DMHP and they were requested to get the training, but obviously they refused. They are the part of God. Why will they come to this? Okay, then ASA worker, Ayush doctors even. Not every patient prefer allopathy. Sometimes they will go to Ayush doctors. So Ayush will also be able to recognize mental health problems and treat. But what drug they will prescribe, I don't know. Okay. The MO training material, I will share that with you. In my suggestion, please go through it briefly. It will be work for your even final year psychiatry. Okay. If you read that, you can. I saw that material last week, and it is actually well written. And if you write in your final exam, use that for reading in your final exam, last minute revision. It is a good thing. Okay, and then IC and targeted intervention, where it should be displayed, that is mental health awareness camp, life skill training to teachers, college, workplace, TV and radio program even, then wall paintings, bus stickers, Arogya Mela, that is a thing. We know it as a different name in our state previously. What was that? Duare Sarkar. ঠিক আছে? What was that? It is coming under Arogya Mela. Arogya Mela is not only for mental health, but other diseases also, other preventable disease. Then obviously counseling center, and where you can get the clinical service, that is outpatient, outreach camp, house to house visit, but it is not done that much done. Then Mono Chaitanya camp and PHC. Mono Chaitanya camp, what is that? It was an initiative taken by I think one south state, probably Tamil Nadu. Actually they named their specific mental health outreach camp as Mono Chaitanya camp, where advanced type of detection and medication will be are given. Okay. Then what are the new components that was proposed in DMHP? First is school mental health services, then college counseling, workplace stress management and suicide prevention services. What are the sites? That was counseling center at district level, sensitization workshop, IC, and collaboration with various departments. Okay. Now coming to the other things. This is a detailed of a staff approved by a DMHP district. What is the number of psychiatrists? 1, and clinical psychologist 1. Remember these two, okay? Because it might came as a potential MCQ, that staffing pattern is obviously a important question. Now it is more than important because it has never been asked. But these tables are widely displayed, and it is usually what students tend do, they tend to avoid the tables. Who have to remember this? But from there actually question might come. Okay. How much ASA workers should be in a sub-center? 1, 2, 3, 4. You know about the people, that every 5,000 or 3,000. But what is the staffing pattern? Another thing, that is what are the roles and responsibilities. First, district program officer, who is in charge of the DMHP. What lead the mental health programs. Then with zonal medical college or institution for tertiary care services, and provide community mental health services. What was the community mental health service? That which was done in outreach camps. Then also what to do with zonal medical college institution, you should arrange for capacity building courses. Obviously implement the activities we discussed before with the support of DMHP team, and coordinate with the state nodal officer of NMHP. This is the role and responsibility of the district program officer. What is done by clinical psychologist? Remember, these are different. What a psychiatrist do, clinical psychologist will not. Okay, there is a difference. So, what is the role and responsibility of clinical psychologists? First, provide counseling, okay, psychotherapy, but not the medical therapy. What you can, a psychologist, what they can do? They can provide counseling service, but not the medication. But a psychiatrist can prescribe medication. একটা সিনেমা ছিল না শাহরুখ খান আর আলিয়া ভাটের, ডিয়ার জিন্দেগি, হ্যাঁ। What do you think? Shahrukh Khan was psychiatrist or psychologist? Psychologist. He was never ever supposed to prescribe drugs. কেন গ্লোরিফাই করা হলো সাইকিয়াট্রিস্টের কাছে না গিয়ে সেটা আমি জানি না। কারণ সাইকোলজিস্ট অনেক সময় ক্লিনিক্যাল সাইকোলজিস্টও সাইকোলজি সাবজেক্ট থেকে পড়েই চলে আসে। I hope another matter. Coordinate with NGOs in providing life skill education and counseling service in schools. As we are not capable enough to reach to the population, we take help from various NGOs. Okay, there is a list of NGOs. It is provided. Try to remember one or two. Then coordinate with NGOs for conducting workplace stress management. Many NGOs right now work on any workplace stress. Okay, these NGOs are affiliated with the companies to reduce the stress level of their workers. So, what is the role of a clinical psychologist? To coordinate with them only to get the report, or if those NGO worker, if he or she thinks that okay, this worker is probably suffering from any mental stress, that worker will be referred to a clinical psychologist. And if the psychologist is failed, then coming the role of the psychiatrist. Okay. And obviously coordinated with the psychology department of a college in establishing a district counseling center, and coordinate with the psychology department of college in establishing college counseling services. So, clinical psychologist work is not only treat the patient, but also he is the HR of the mental health facilities. Okay, he has to keep in touch with the other departments, and this is a potential short note. What are the role of a clinical psychologist? What is the work of a social worker? You can already assume social worker, what he or she will do, that is social work. Participating in general health camp, training of health worker, organize welfare services, organize microfinance. So he or she will be the accountant. Just designation is different. Then organize day care for psychiatric patient and maintain register. What were the service provided in Ayushman Arogya Mandir? Ayushman Arogya Mandir means sub-center or PHC, sir? What was the meaning of Ayushman Arogya Mandir? Sub-center or PHC? Sub-center is also called Ayushman Arogya Mandir. Everything is called now as Ayushman Arogya Mandir. Okay. What was the component in Ayushman Arogya Mandir? That they have provided operational guidelines which were stated earlier to implement this, and obviously run a de-addiction center. Nothing else. Okay. What was the PHC's program? Outpatient service, referral of patient. Obviously, jeta parbo na refer korbo, OPD te dekhbo. PHC will do. PHC have embedded service? Obviously, there are bedded PHCs. But do they admit mental patient? No, sir. They only give outpatient service for mental health. And then there will be referral, counseling, and proactive case findings, which will be done again by the social workers. Then what has the CHC done? Again outpatient service, and now inpatient service is added. There will be a psychiatric ward and obviously the counseling services. Okay. District hospital and medical college, obviously previous those has been done, now everything is in large scale. And what will they run? Satellite clinic. Okay. And also they will give directly college counseling and counseling of out of school children. But the satellite clinic, that will be run by district hospital or medical colleges. Okay. And they has to have a 10-bedded inpatient facility. It might be higher depending upon the population of your area, but it has to be at least 10%. I think that is why if this is also a medical college and it also has 10% facility. But if that is that much small, that is and you are too much familiar with your own college, that is why you cannot find it. Okay. You did not, sorry, not cannot, you did not find it. This is Taluk mental health program. This is just like district. Sometimes under the district, there are also taluka. If you go by land revenue office, these areas also divided in taluks. Again the same thing, and it is not asked that much. Okay. Now, Manodarpan initiative. Although those who you are Bengali, actually I understand what is the Darpan means. Mirror, correct. So, what is there in the, what's the initiative say? That to provide, their objective was to provide psychological support to student, teacher and families. So, not only students, but teachers also feel stress, okay. And obviously, if you are that much good sons and daughters, the families will feel stress too. And before the school health program, only the mental health of the students were actually that was their component or service, that they will give the service to only students. But in Manodarpan initiative, teachers and the parents' family also came under this, came under their radar. Actually, a person probably is not suffering from any workplace stress, but he is stressed about his own son or daughter. He is showing the symptoms. Who to identify and where to get where to get the service. There was a potential gap in between there. That is why the Manodarpan initiative actually started. What were their features? They have a national helpline and obviously web-based resources and psychosocial support services. These all also come under Tele-MANAS. Okay. Now coming to your most important part of the mental health programs, that is National Tele-Mental Health Program or Tele-MANAS, started in 10th October 2022. Remember this year, 2022. Okay. Run by Ministry of Health and Family Welfare. Manodarpan run by Ministry of Education. Any other program run by Ministry of Education? What was the aim? To strengthen mental health services using digital platform. Obviously now we are living in a digital age, so we have to use the technology. যারা আসতে পারছে না স্টিগমার জন্য তারা কি করবে? At least phone করবে. So we have to have a 24/7 hour helpline, and তখন helpline তৈরি করা হলো. For promotion, we launched it as another program, that is Tele-MANAS program or National Tele-Mental Health Program. Okay. Where it was actually mainly goal was to T-MANAS or Tele-MANAS for provide 24/7 telephonic mental health service, and where it is applicable for remote areas, and obviously to make the mental health a priority. What is the number? First, this is the application page, Tele-MANAS. Okay, this is the interface. If you are willing to, or if you have any space in your phone, you can download this app and see the resource materials or principles. Okay. What is the number? That is 14416. The number actually, if you call, it will be answered. First they will ask what is your preferred language, whether English or any other regional. Okay. These are the aims and objectives. You already know the aim. Tele-MANAS is a potential short note question, so you can read on it. These are the same as the DMHP components, nothing different. So if you write everything, after that add the digital word. That is they are focusing on. We are also writing that digital word. Everything what DMHP do, it is the same, whatever the objectives of DMHP, same objectives are for Tele-MANAS, but it will be done using digital platform. So digital word should be there. Okay. What is the calling mechanism? First, if I call the Tele-MANAS number, first it will connect with an IVRS based system, where what is my preferred language, it will be asked that if you want English, press 1, if you want this language, press 2. কেউ অ্যাটলিস্ট নিজেদের গ্যাস বুক করেছো ঘরে একবারও? হ্যাঁ, সেখানে জিজ্ঞেস করে না, এবং তারপর হচ্ছে একটা সময়ের পর ধৈর্য চলে যায়। Whatever, then first who will get in with touch, that is counselor. Counselor will hear you about your problems, and concurrently he or she will try to diagnose your problem and what will be the course. ঠিক আছে? Then if he or she understand there is some special requirements on your part is needed, then he or she will refer you to a mental health specialist, clinical psychologist, or a psychiatric or social worker, sometimes even psychiatric nurse, or even a psychiatrist, if he or she thinks that your problem is in grave nature and you need urgent medication, then he or she will address you to directly a psychiatrist. Otherwise, you will be your call will be diverted to any psychologist or social worker. What was your problem in the nature? What was the nature of your problem? You will be referred like that. Then what are the benefits? First, you can get the free counseling. Then it is easily accessible and it is done in your preferred language. 24/7 availability. There will be follow-up calls, and your identity is totally confidential. You do not have to state your name, age, gender, anything. Okay. Sorry, in previous part that was the tier 1, and if psychiatrists or psychologists think that you has to be hospitalized right now, then he or she will refer you to tier 2. That what is that? In-person service, that is PHC, CHC, SDH. What is the available and what do you need? If you need some specific intervention, then you will be referred to the higher center. Okay. And what is the drug portal? That is e-Sanjeevani, where you can get the free drugs. Benefits we discussed. Then coming to this is the official poster of Tele-MANAS. I did not find our West Bengal. Probably in West Bengal we do not have some mental patients, but I found the Jharkhand. There is one part this. Who can call? First, anyone in distress. If you are suffering from depression or anxiety, if you are on the verge of self-harm or suicidal thoughts, obviously alcohol, cannabis and tobacco abuse. If you are also having sleep problem, sexual problem, memory problem, family and relationship issues, psychological problems, workplace, mental health scheme and any other mental health concern. Now, even if you have some concern, you can call. Okay. In your short note, obviously, add this part, who can call. Okay. Then another component, what were under the school health and wellness program, include mental health as one of the key health promotion areas, and there are what they said that train the teachers on life skill, and obviously health and wellness made them as health and wellness ambassador to talk about emotional well-being, stress and resilience. Usually one of the teachers in the existing school will make that health and wellness ambassador, and they will talk with you on that part. Okay, you all know that Nasamukht Bharat Abhiyan, right? Everyone knows that. It is also launched on 2020, and what it states that what is the focus? Substance use prevention component, awareness generation, counseling service and community based intervention. দেখতে পেলেই পেটাও। This is primary care psychiatry program, not important in your case. What was the reason? Because West Bengal is not part of it. Now coming to the important part, and actually this is a potential 10-number long question, that how national mental health program is incorporated into other programs. There are 14 running national programs where we do have mental health component, and those mental health components actually come from National Mental Health Program. Okay, what was the obviously this is the first and second, do you know? Then there is Mental Health Care Act, then Manodarpan Initiative, Tele-MANAS, School Health and Wellness Program, and Nasamukht Bharat Abhiyan. You all know this. Do you know this now? National Health Mission. Actually under National Health Mission all program comes. All the recruitment of doctors is done using National Health Mission. Two part, NRHM, NUHM. R for rural, U for urban. Then obviously Rashtriya Kishor Sasthya Karyakram, RKSK. You all, I think FHC is taught by me, na? Adolescent Friendly Health Services, Health Center. In FHC there was also counseling part. These counselors were appointed through NMHP. Okay. Then obviously there are NP CDCS, or now we know it as NP NCD. What we do here? Here also we do stress management counseling in NCD clinics. It was done. It is done under NMHP. Then integrated child development service, where early childhood stimulation, mental development, even parenting education is given. Then Poshan Abhiyan. Here also maternal mental health recognition and child development. What are the issues in maternal mental health? Huh? What is the issues? পড়েছো? Postpartum depression, at least এই টার্মটা তো জানো। তেমনি আর আছে postpartum blues. Obviously this happens after postpartum. That is why even I have seen a case where a postpartum depressed mother killed her own son out of the result of it. Okay, we encountered one case during my internships. Okay, then National AIDS Control Program. Those who are suffering from AIDS, they also needed counseling for the drug adherence and to reduce the stigma. And obviously Swachh Bharat, Swachh Vidyalaya. This is coming. What is that? That is the school component is named now. Where school children, what is the promotion? They promote safe, hygienic and inclusive school environment and support psychosocial well-being. আগে সরকারি স্কুলগুলোয় দেওয়ালে এটা সেটা অনেক কিছুই লেখা থাকতো, কিছু ক্ষেত্রে টিচারকে স্ল্যাং, কখনো বা আরও অন্য কিছু লেখা থাকতো, ক্লাসের একটা ছেলের সঙ্গে আরও অন্য কিছু, ঠিক আছে? সো এগুলো যাতে না থাকে, বিকজ আমার অন্য কারো কাছে ইট ইজ এন্টারটেনিং, বাট টু আদার্স ইট ইজ ডিস্টার্বিং। যেমন ট্রেনের বাথরুমগুলোয় আগে থাকতো, হ্যাঁ, অত যথেষ্ট বড় হয়েছে, আগে ট্রেনের বাথরুমগুলোয় লেখা থাকতো, পেনে দেখবে, স্কেচ পেন দিয়ে অনেকে অনেক কিছু লিখে রাখতো, এমনকি ফোন নাম্বারও লেখা থাকতো, তাই তো? লোকাল ট্রেনে চড়ার অভিজ্ঞতা আছে তো নাকি? These are the important dates. I don't know if it is important or not, but at least September 10, that is World Suicide Prevention Day, and 24th May, World Schizophrenia Day. This June 21, International Day of Yoga. You can remember that also, because the question, MCQ question also depends on the government, okay? This is incorporated by our own now central government, so you can remember the dates, this date, okay? And what is the World Mental Health Day? That is 10th October. What are the notable NGOs? You remember Bhim Hands and Your Dost, because Bhim Hands, because it is similar to Neem Hands, so there is a chance of wrong answer. That is why Bhim Hands. What is Bhim Hands? It's a Delhi based NGO only on de-addiction and counseling. And what is Your Dost? That is an online platform for online chat and video counseling. ঠিক আছে? There are too much NGOs on that, because it is a lucrative area. Government is understaffed, and but government has promoting too much money onto this. So NGOs are coming like ants to the honey pot. So what are the conclusion of 2 class? So mental health is obviously integral part. Early identification and destigmatization is important, and there are programs NMHP and DMHP which is associated with RKSK, RBSK, Tele-MANAS and AFHCs, and also ICDS to incorporate the mental health.